I'm Richard Page, chiropractic physician with 25 years in practice. I serve the hardworking agricultural community of McMinnville and Yamhill County. On March 11th, 24, Rogelio presented on referral from his urologist for evaluation of an abdominopelvic pain coming from his low back. However, when he arrived, he noted that a week prior, on March 3rd, he was working at the winery where he has been employed for 15 years, carrying a very large, heavy table on an uneven surface in a field with 3 coworkers. When he stepped down into a hole, he felt a searing pain in the middle of his back where his ribs and his low back connect. A couple of days later, he presented to the Willamette Valley Medical Center emergency department where he was evaluated. They took x-rays, which showed some old conditions in his back, but did not explain the pain in the location where he was experiencing pain from the work injury. He called several clinics in town, including his primary clinic, who would not accept his claim to see him under the work comp claim due to frustrations and limitations within the system. When he came in, I performed a full evaluation, and I recommended seeking an attending physician at the local occupational health clinic because I believed management of this case would require a longer period of time than the 60 days currently allowed under the workers' compensation guidelines. His pain was consistent with something that needed additional medical management. He went on my recommendation to the occupational health clinic. He was denied care by the physician on staff that day because he was referred by a chiropractor, even though I had not become the attending provider at that point. I saw him 3 days later, and since he had been denied care, I decided to take the lead on the case and become the attending. He was experiencing bilateral radiculopathy into his legs, but he continued to work at the winery with limitation, operating tractors and equipment. At night, he experienced pain in the low back region and on both sides into his legs with numbness in his lower extremities. We contacted his primary care physician for pain management medications and muscle relaxers, which they agreed to. His had run out from the emergency department 2 weeks prior, and we were managing the patient conservatively with soft tissue therapies and trying to keep his spasms at bay, thinking that maybe this was a muscular sprain-strain injury with nothing had shown up on x-ray at the emergency department. But he continued to use his hands to unweight. So on the 27th, 27 days into the injury, we requested authorization for MRI through his workers' compensation carrier. And we got approval 10 days later for the imaging. Now, I have to keep in mind that this time is running out. We only have 6 weeks to manage the patient. From 11 March to mid-April, by this point, only 4 weeks in, his carrier had already generated an IME to one of their physicians. The MRI was scheduled for 10 April 2024 and demonstrated a compression fracture of T12 with marrow edema. This is consistent with an acute fracture. I had 12 days left to manage this patient under the current guidelines. I began seeking another provider to take over the case. I contacted Willamette Valley Medical Center Orthopedics, who no longer does spine care. Providence Orthopedics, Physiatry. I contacted Spinal Diagnostics in Newburgh. I sent referrals. 7 days later, from Spinal Diagnostics, with only 3 days left to manage the case, they noted that they would accept the referral to treat once there was a different attending physician and recommended a spinal surgeon in Beaverton. I reached out to the surgeon in Beaverton, who would not take the case of the attending because of difficulties with the insurance company. So I again contacted the occupational medicine clinic in McMinnville and personally spoke to the nurse practitioner who I've worked with previously. It was the same clinic, remember, that denied care before. She agreed to take the case, and her appointment was scheduled for 30 April 2024, now 2 months after his original injury, and I could no longer be the attending physician. We switched the attending to the occupational health clinic, and I kept up with the patient on my schedule to ensure proper management, making sure he was getting taken care of. On 10 June, SAFE had closed his case. Occupational Health had sent him to Dr. Sales at Summit Orthopedics, where he was unable to render services for the insurance company, or per the insurance company, and then was sent to Columbia Pain Management in Milwaukee. So he's been off and on with different attending providers since his injury. His care has been poorly managed, largely due to the constant need to change attending providers and physicians, understandably because of the reluctance to participate in his injury recovery, because of the frustrations with the insurance system for occupationally injured employees. His care has been substandard. On 29th of October, last time I saw him, he still had bilateral pain down his legs to his calf, and he'd been off work for 2 weeks. I strongly believe that this patient would be well and whole by now if continued attending status was permitted. The need to transfer the attending status is a disruption in the management of the patient's care. It causes delay in care, undue medical expenses. It lowers the standard of care. Industrial economic hardships exist with time loss of valuable employees at this winery, and financial and emotional hardships for the injured worker and their families. Thank you.